have an announcement, and it's unfortunate that we have to come back to where we are. My phone was ringing, I'm sure you guys noticed, and it was our public health director telling me that we just had our first Omicron-related death. A man in his 50s resides in Harris County Precinct 2. And look, I know for folks in Harris County this feels like whiplash. We saw the downward trend in hospitalizations and in cases only to see things trend back up again, and it is so frustrating. I feel it too. And I understand the impulse to just tune out the latest news and just be sick and tired of all of this. But as we've been expecting, the Omicron variant of COVID-19 has arrived in full force. The good news is that with Omicron, it appears that so long as you are vaccinated and boosted, the rate of hospitalizations is decoupling from infections. Of course, we're going to have hospitalizations, tragically, deaths like what we see now. But the evidence shows that for those vaccinated and with the booster, it is much less likely that they're going to end up in the hospital. So that is a huge light at the end of the tunnel for all of us. This can be something that just makes us a little bit sick for a few days, but the only way we achieve that is through the vaccines and the booster. The bad news is twofold. Omicron is spreading incredibly quickly. First, we know that an increasing number of cases in Harris County are related to Omicron. It's more transmissible. The amount of time it takes for the number of Omicron cases to double has been very worrisome. Early data suggests it's doubling in 2 to 3 days, according to the CDC. Just to give a point of comparison, the Delta variant doubles every 11 days. And the second piece of tough news is Omicron is producing breakthrough infections. So folks with the vaccine are getting it. That does not mean the vaccine doesn't work. On the contrary, the evidence shows the vaccine is going to keep you out of the hospital. But we are seeing an increase in breakthrough cases. And I want the community to be prepared, because the truth is, in some ways, we are our own experiment. Every day we learn something new about this virus. We don't know how many of those breakthrough cases will end up turning into hospitalizations. We do know that the vaccine and the booster will keep that number very low, and that is truly our solution. Third thing, the Omicron variant is hitting older folks particularly hard. A majority of the severe breakthrough cases are in folks 65 and up. More than 2/3, 69% of breakthrough COVID-19 hospitalizations are on folks 65 and older. But it's much better when folks have their booster. And so in response to all of this, today I'm raising the COVID-19 threat level from yellow to orange. At this level, unvaccinated residents need to minimize contact with others, avoiding any medium or large gatherings. If you are vaccinated, and everybody here is vaccinated, we are not asking you to avoid travel or avoid going out. We are asking you to be vigilant. We are asking you to wear your mask. We are asking you to get your booster. Of course, you should be vaccinated. Vaccines continue to be free and available. And to everybody who already has their first 2 shots, the time to get your booster shot is now. As we approach Christmas and New Year's, give yourself, give your family the gift of health. Get your booster, especially if you're 65 and older. If you're hearing me right now, walk out the door and go get the booster. But truly, everybody needs to go get it. These trends are incredibly frustrating, especially as we close out the year. We want to be with friends and family, but please take precautions, wear your mask, get tested. And number one, far above anything else, get your vaccine and get your booster. Let's protect that sense of normalcy we've earned over the past 2 years.